Okay, this is my second part of the head to toe assessment. I already performed YPA in the first part, so we're just going to continue with range of motions. So can you stand up for me? Okay, can you do your arms up, back, down, behind your back like this? Oh, crepitus noted. Can you do up? Okay, down. Can you go out, in, down? Okay, can you go up again? Okay. Full range of motion for the shoulders without limitations. I palpated some crepitus. I would palpate for that bilaterally, but for the video I'm not going to do that. Okay, now we're going to do elbows. So can you do this? Down. Okay, can you do it one more time? No crepitus noted on the elbows. There was full range of motion without limitations for that. Okay, and for the wrist, can you go down, up, in, out? Okay, can you do that again? Okay. No crepitus noted for the wrist. The range of motion for the wrists are fully intact with no limitations. For fingers, can you go? Yes. Okay, and full range of motions for the fingers without limitations. I don't know if I said this, but for the wrist, I did not palpate any crepitus. There's none noted. So looking at her muscles, they are symmetrical and even. I see no signs of muscle wasting anteriorly or posteriorly. Okay, and now we're going to do the push-pull muscle strength. So can you pull? Can you push? Okay, oh, thank you. So her push-pull muscle strength's intact. So can you grab my finger and squeeze? Okay, her muscle strength is bilaterally even and smooth. So now we're going to go to the lower extremities. So can you lay on the bed? Okay. Okay. So looking at her lower extremities, I see no signs of muscle atrophy. They're symmetrical. I'm going to go ahead and look at her toenails and get that over with. So they're smooth, pink, no ridges or clubbing. Her cap refills less than 3 seconds. I forgot to do that on her upper fingernails, so I'm going to do that too. Her fingernails are smooth, pink, with no ridges or clubbing, and her cap refills less than 3 seconds. So now we're going to do the range of motion. So can you bend your knee up and up? Okay, and down. And can you go out? No. And in. Okay. And can you bend both of your, and can you push, okay, pull? So her muscle strength's intact. Range of motion of her hip is intact. Can you just do that? Yeah. Okay. I palpated no crepitus in her hips as we did that. Can you bend your knee up again? Okay, I palpated no crepitus as she did that. For your ankles, can you point them down and back, and soles in and soles out? Okay, so that's fully intact without limitation. Can you move your ankle up again? Okay, I palpated no crepitus in her ankles, knees, or hips. So her range of motion there is fully intact. And I would palpate both sides bilaterally, but I'm not going to do that for the video. Okay, now, if you will sit up. I need you to stand so I can do the back. Okay. Her scapula, rib cage, her iliac crest, and her gluteal folds are all horizontal and even. Can you bend down? Her cervical part of her vertebrae is concave, the thoracic is convex, and then her lumbar is concave. Her vertebrae are straight with no scoliotic deviation. Okay. Her muscles appear to be symmetrical, so we're going to do range of motion of the back and spine. So can you bend forward at the waist? Okay, and back. I know it's hard. And can you go right? And can you go left? I knew it popped. It cracked. Okay, she has full range of motion of her back and spine. Okay, now we're going to do lungs. Can you sit? Okay, so first I'm going to do the percussion part. And I'm going to get my hammer out to do it. Okay, and there's 6 spots on the front. So I'm sorry.
You're fine.
5, 6. Okay. Oh, hold on. 1, 2, 3. Hold on. 4. Okay. 5, 6. Okay, and I heard resonance on all those sounds. Can you turn around? Thank you. Okay, there's 3 spots on each shoulder. So. Okay. Okay, and that was dull. So now I'm going to do 9 sounds on the back. So. 8, 9. And I heard resonance on all of those areas. Her breathing appears to be effortless within a normal range. I see no signs of barrel chest. Her transverse ratio is 1 to 2. Her respirations are smooth, even. I see no abnormal breathing patterns. Okay, now I'm going to auscultate. So before I auscultate, if I was listening to bronchial sounds, it would be up here. Bronchiovesicular at the inside, and then vesicular on the outer lobes. And posteriorly, okay, I would listen to the bronchovesicular up here, and then vesicular on the outer parts. Okay, so now auscultate with my diaphragm for a whole respiratory cycle, but I'm not going to do that for the video. I would start up here. Let me do 1, 1, 2, 2, 3, 3, 4, 5, 5, and then 6, 6. Her lungs sounded patent and clear. I heard no wheezing, stridor, or any abnormalities. Can you turn around? Okay, and I'm just going to also take the bag, and there are 9 regions here that I'm going to listen to. Okay, so I'm going to go 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, and 9, 9. All her lobes were patent and clear. I heard no abnormal sounds. Okay, now I'm going to do the heart. So using my stethoscope, I would first listen to the point of max impulse. So can you lay on your left side? Okay, it is in the 5th intercostal space, so I would palpate and then auscultate with my bell for a full 60 seconds, and I heard nothing abnormal with that. So can you stop? Okay, now I'm going to name the sounds, the regions where I would listen to the different sounds of the heart, and there are 5. So, for aortic, it's the 2nd left intercostal space, and I would use my diaphragm for S1, S2, and my bell for murmur. So S1, S2 present, no murmurs. Then the right 2nd intercostal space is the pulmonic. I would use my diaphragm for S1, S2, the bell for murmurs. S1, S2 is present, no murmurs noted. Erb's point, which is the third intercostal space, I would use only the diaphragm for S1, S2, and it's the loudest here. Then I would move down to the fifth intercostal space, and that would be tricuspid, and I would use the diaphragm for S1, S2, bell for murmur. S1, S2 present, no murmurs noted. And then I would go down here, the fifth midclavicular space, and I would do diaphragm S1, S2, and then bell murmur, and that's the mitral. And then I would auscultate and palpate her apical pulse as well as her radial. And they are equal with regular rhythm and smooth. There's no abnormalities there. Okay, I'm now going to do the pulses. So I would count the pulses for a full minute each, but I'm not going to do that for the video. So I would do the brachial, radial, ulnar, femoral. Sorry. I would do the popliteal. I would do the dorsalis, pedis, and then the posterior tibialis. Yeah. And they're all plus 2 bilaterally, smooth and equal. And then I'm going to do, I think I'm going to do the breast now. Okay, so for the breast, I would look at the patient's breast, and I would say that they appear to be smooth, full. I see no redness, bulging, or outer abnormalities. I would then palpate the breast, and I would start at the talus spence and go down using an inch border, 3 fingers in a circular motion using light, medium, and deep palpation. So I would go down and then up and then down until I hit the sternum. And I would note if there are any nodules, masses, bulging, abnormalities, or tenderness. I would then compress the nipple and areola with my thumb and first finger looking for discharge. I would say none is noted. I'm now going to name the lymph nodes of the breast. So we have epitrochlear, lateral axillary, central axillary, subscapular, and then pectoral. And I would say none are palpable. So now I'm going to do the abdomen. So I'm going to auscultate, percuss, and palpate. So first, I'm going to auscultate. Actually, no, I'm going to talk about the abdomen first, sorry. So, I'm going to get my pen light. Looking at her abdomen, come over here. It is flat. I see no redness, striae, scars, tattoos, bruising, lesions, anything abnormal. Okay, now I'm going to auscultate. So I'm going to listen to each quadrant, and I would listen to that for a full minute each, but for the video I'm not going to do that. So I would listen using my diaphragm. So I would start in the right lower quadrant, right upper quadrant, the left upper quadrant, and the left lower quadrant. And there were vowel sounds present in all 4 quadrants, and they all sounded the same. There was no irregularities with it. I would then, I'm going to percuss. I would percuss each quadrant, so I would start with the right lower, right upper. Let me know if any of this hurts. Left upper, and left lower. Sides didn't hurt at all? No. Okay, and I heard tympany on all 4 quadrants, and she said there was no tenderness noted. So now I'm going to palpate and just let me know if any of this is uncomfortable. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Yeah. Okay, so no tenderness was noted. I didn't feel any bulging, masses, nodules, anything abnormal there. So now I'm going to verbalize the genitalia part. So if my patient was a female, I would first look at their pubic hair. It should be dark, coarse, and curly. It should be even in distribution. There should be no inhabitants noted. It should be in an inverted triangle shape from the pubis to the pubis symphysis. Looking at the skin around the pubic area, there should be no lesions, vesicles, papules, rashes, any irregularities. And then I would look at the labia majora, which is the largest hood. It should be pink, moist, plump, with no bulging, redness, nodules, lesions, ulcers, any of that. And it should be smooth. I would then look at the labia minora, which is a smaller hood. It should be dark pink, smooth, with no bulging or swelling, no redness, papules, any of that on there. And then I would look at the urethral meatus, which should be a slit at the midline. I would then look at the vulva. There should be no discolorations or bulging there. And I would then look at the rectum for hemorrhoids, and none should be noted. I would then move on to if I had a male client, for their genitalia, I would begin with the pubic hair. It should be coarse, curly, and dark. It should be evenly distributed. It should be an inverted triangle beginning at the pubis symphysis, and there should be no inhabitants or lesions. Looking at the skin of the pubic area, there should be no lesions, vesicles, papules, rashes, any redness, anything abnormal there. I would then look at the skin of the penis, and it should be smooth, pink, wrinkly, and without hair. There should be no nodules, masses, ulcers, rashes, anything abnormal there. I would then look at the glands, and I would compress it with my thumb and finger and look for discharge. There should be no discharge noted. The urethral meatus should be at the end of the penis and at the center. There should be no discharge there. I would then look at the scrotum of the patient. It should be soft and spongy in texture. It might feel a little tender upon palpation, like light palpation, but it shouldn't be super bad. There should be no rashes, discoloration. I should see 2 testicles. No rashes, redness, bulging, swelling, any of that. I would then move on to the prostate exam. So I would lubricate one finger, have the patient in the supine position. I would then insert it into their rectum and going up the inguinal pathway. And I would palpate the prostate. It should be firm, elastic, heart-shaped. And it should be firm but not really hard. And it shouldn't be super tender. So yeah. And then I would inspect the rectal area for hemorrhoids, and none should be noted. And then I'm going to do the sensory test. So can you close your eyes? Okay, and let me know when you feel a light sensation anywhere on your body. No. Okay, she is sensitive to light touch. Now going to do the wonderful sharp dull sensation. Okay, can you close your eyes and tell me if this is sharp or dull?
Dull. Sharp.
Sharp. Sharp.
Dull. Sharp. Dull?
Yes. Okay. She can differentiate between sharp and dull, so all her sensory stuff's intact. We're now going to do the cerebellar test. So with your hands on your lap, can you flip them around like this? Okay. And can you do the heel to shin on the opposite side and down? And on the other side, can you do your fingers really round and backwards? Okay. And then can you do the, I need you to touch your nose and then my finger. And then back. Okay, can you do the other one? Your other hand, Kayla. Okay. And can you walk heel to toe in a line with me, please? Okay, she can do it. Okay, so her cerebellar function is intact. I'm now going to do the reflexes. So when I'm doing the reflexes, I would do it to both sides, but for the video, I'm just gonna say I did it bilaterally. So I would start with the biceps. Okay, so I'm gonna feel right here. I'm gonna do the thumb, sorry. Okay, that's a +2. I'm then gonna do the triceps. Okay. Oh, sorry, hang your arm on me, yeah. Okay, that's a +2. I'm then gonna do the brachioradialis. So can you do your thumb out? Yeah. All right, ready? Okay, that's a +2. Okay, and now I'm gonna do the patellar. So yeah, dangle your little legs. Okay, that's a +2, and then I'm gonna do Achilles. Kind of flex a little bit, yeah. Okay, that's a +2, and then can you lay down for me? Gonna do the plantar superficial reflex. Okay, you ready? It might tickle. Oh my gosh, I'm sorry. Okay, it was negative. And I would do that bilaterally and they would all be +2. So I think that's it.